Kelly with Warrenwood's Veterinary Hospital. Today we're going to go over and show you how to perform a rabbit exam and what we do here. First, the technician will come into the room and talk with you a little bit about what's been going on at home. They'll ask you questions about diet history and ask you about any other concerns that you've been having at home. They'll also get an updated weight as well as a temperature on your pet. So first we kind of look at them and just overall how they're acting. He's bright and alert, he's looking around, he's nervous so his fur is flying everywhere, but overall he's bright and active. So what we do next is we kind of feel and make sure that they're not too chunky, not too skinny. Rabbits should have pretty good fat stores around their spine, but you should still be able to feel it. Then what we do is feel in their abdomen and make sure that there's nothing strange going on in there. No impacted food, no tumors. I can feel his kidneys, they're a good size. He doesn't care for this so much, but it's a good way to feel what's going on inside there. Okay. Then what we do is listen for gut sounds. Rabbits have really, really important and sensitive GI systems, so you should always be able to hear the gut sounds. Okay, and they're nice and frequent, so that tells me that his gut is healthy right now. Then what we'll do is listen to his heart and lungs, make sure we don't hear any murmurs or arrhythmias. Okay, and everything sounds good in there. Then what we'll do is turn him upside down so that we can take a look at his underside. And so what we'll do now is look at his nails, check out his joints, make sure that everything down here looks good. No foot sores or anything like that. Looking so good. Make sure there's no issues down here. And just kind of overall looking at coat quality. Move up to the front limbs. He just had a pedicure, so his nails are not super long. No, you're okay. Okay, and then we'll go ahead and place him back down. He's good. Okay, give me a minute. Okay, and then the last thing that I examine is their heads. So rabbits have a tendency to be really nervous when things come up to them because they're a prey animal. And so I always leave that until last. So we'll check the eyes, make sure that those look clear, that there's no issues with those. Boy. And then we'll check his ears as well, make sure there isn't excess gunk in there. Very well. And then the last thing that we do is look in their mouth. Rabbits have a tendency to have dental disease, particularly if they're not on an appropriate diet, meaning majority hay. And so sometimes their teeth can become overgrown and then we have to actually trim them down. So I always leave this until last because they tend to not like it very much. It's okay, buddy. So the last thing, then you're all done. So we'll check his nose real quick, make sure there's no drainage. And then check out his teeth. Rabbits have their incisors in the front that they use to grab food with, and then they also have some cheek teeth in the back. And sometimes if they're not on an appropriate diet, that those cheek teeth will overgrow and form points, and sometimes it can make them stop eating because it's just so uncomfortable back there. So we'll take a look back here. Get your tongue out of the way. Boy. And no points on that side. I can see his mucous membrane color. It's nice and pink and moist. I can actually see food back there. He was eating his breakfast this morning. Let's check on the other side. Good boy, George. And this side looks good too. All right, that's the end of your exam. You're okay, bud. So that is how we do exams on rabbits at Warren Woods Veterinary Hospital. And we recommend having an exam every 6 to 12 months or so that way we can kind of catch things and make sure that there's no issues and catch them ahead of time so that way we can do something about them.